Hello and welcome to the Desiree Show. Today I have a very special guest in the studio, Dr. Richard Nagelberg. Hello, Dr. Nagelberg. Thank you for being the first dentist on the Desiree Show.
Hello, Desiree. It's great to be here.
Thank you. Well, let me tell the viewers a little bit about you. Now, Dr. Nagelberg has been practicing general dentistry for nearly 30 years. He's a speaker and advocate on the medical manifestations of periodontal disease and systemic links. He's the recipient of Dentistry Today's top clinicians in continuing education for the past 3 years in a row. And as a valued member of the dental community, he tours the nation and lectures nationally and internationally on a variety of topics, including the positive impact dental professionals have beyond the oral cavity. Whew! He's big doing over here. So now we have a lot to talk about. Our show is usually based on dental hygiene and to dental hygienists, but your practice in particular is very hygiene based, right?
It is. My practice is very hygiene based. We have a very well-defined hygiene program in the office. We understand how to take care of periodontal disease and the importance of doing so, and we've made some changes in the office over the number of years I've been there. We used to have hour-long hygiene appointments, and we had a thought, my partner and I, that we might capture more revenue if we went from hour-long to 45-minute-long appointments. And so we instituted that. We had some pushback, which we understood from the hygienists, and we said, well, let's give it a chance, let's see what happens. We'll give it a try, and they said, okay. Well, we learned in very short order that it didn't work at all. It just did not work well. If you're committed to providing perio services in a comprehensive manner to take care of the patients as they need to be taken care of properly, 45 minutes is inadequate. And we learned that very quickly. If you want to be just a prophy mill or you want to just do chat and polish, 45 minutes is more than enough time.
Right.
And we found that it was an issue with disinfection of the rooms, for cultivating a relationship with the patients in order to accomplish education, to make the patient understand the importance of periodontal disease and treating it and getting it under control.
Sort of establishing a relationship.
Exactly. And that relationship everything really is ultimately based on what does it do for the patient. And that relationship really is probably the primary driver in that because they trust the hygienist. We found out in very short order that 45-minute appointments did not work well. In fact, not even from a revenue standpoint, but primarily from a care standpoint, it did not work. So we went back to hour-long appointments, and we found that from every aspect, whether it's a care aspect or a revenue aspect, it worked much better. So if you're committed to doing perio services in a comprehensive manner, hour-long appointments are what is needed. It gives the hygienist the time to disinfect the room, to cultivate the relationship with the patient. You know, the patient has their own relationship with the hygienist, different than mine. They'll commonly say, when I leave the room, the patient will say to the hygienist, "Do you really think I should do what he said?" And we want that relationship, the hygienist to have that relationship because they understand the importance. We want the hygienist to say, yeah, this is really important. Dr. Nagelberg went over this. I've indicated it as well. So from many standpoints, but primarily the care we can deliver for our patients, hour-long appointments, have proven to be absolutely what's necessary. Now, from a revenue standpoint, it works out better as well. And let's understand that the revenue importance is like third or fourth down on the list.
Right.
It's primarily about the patient, but we found that with hour-long appointments, we have many more patients enrolled in periodontal treatment. About 65% of our patients are perio patients. So when you're providing perio services, we're generating revenue at about $300 or more per hour. Prophy-based service is about half that or less. So from that aspect, we have more revenue. But also, one of the things we didn't necessarily anticipate is every perio patient is coming in for perio maintenance every 3 months for life. 4 times a year gives us an opportunity to potentially diagnose restorative needs. So our restorative care has gone up as well. So from all angles, restorative care, the perio care, and the revenue side, hour-long appointments have proven to be what we need.
Who would have thought 15 minutes would make that much difference? You know, it really does.
It doesn't sound like a lot, but for the hygienists, it makes all the difference in the world. One thing I did neglect to mention is the hygienists were unbelievably stressed out.
I bet.
From the first appointment in the morning, they're running behind schedule. And the biggest stressor by far is running behind schedule in a dental setting. It is just...
And sometimes it's almost impossible to make that time up.
It is. It is impossible. And they get a break during lunch, and then the whole cycle of running behind starts again in the afternoon. So
Indeed.
We had our hygiene staff very stressed out, very anxious, frustrated because they couldn't deliver the care they knew was important to deliver. And now it's much better off. They're much happier. You know, they have adequate time to provide the care they're capable of providing.
Right.
That's
And that really says a lot about your practice and how important the dental hygiene aspect is to you. Now, I mentioned that you tour nationwide and across the world talking about dental hygiene and to dental hygiene professionals specifically. Do you think that's important as a dentist to reach out to that group?
It's critically important. It's really critically important. Among most of the lectures I do, the majority of the attendees are hygienists, whether it's a mixed audience of hygienists and dentists or hygienists, dentists, and physicians. I do speak to a lot of dental hygienist associations, so they're all hygiene audiences, attendees. And why I think it's particularly important is because the hygienists are the people that are delivering non-surgical perio care. The vast majority of perio care is non-surgical. And the hygienists are doing it.
So they're the front line.
They are. They're on the front line. I think of it sometimes like, who's really providing services to the patient in the medical community? It's the nurses. It's not necessarily the physicians. The hands-on care is being provided substantially by nurses. In the dental setting, it's very similar. The hands-on care is being provided by hygienists. So I have patients sometimes say to me, Dr. Nagelberg, I really want you to be doing my cleaning. Or I really want you to be doing my
I'm not that good at it.
Well, my answer is, no, you don't. You do not want me doing that because I haven't done this in years.
Right.
And it's a very difficult skill, and I'm not going to say I'm not qualified to do it, but I don't do it routinely. The hygienists are so much more qualified to do this. What I find in a lecture setting is the hygienists are very interested in the science, but primarily interested in what's this going to do for my patients, the practical aspects of the education. Not just the science, they're interested in the science. I mean, they're clearly so hungry for information.
Right.
And the practical aspects, how is it going to enhance the level of care I'm providing for my patients? And that's key.
That's lovely.
It's not uncommon. At the conclusion of a presentation, hygienists come up to me to talk one-on-one, and they're practicing 40 years, and they're still full of passion. That is so motivating for me as well. It's very energizing.
Goosebumps, literally goosebumps, because I think that's really important to continue that passion.
It is, and they're talking about a patient, and they were struggling, and then they did this and that, and they finally achieved success, and how rewarding it was for them professionally, but how important it was for what they did for the patient.
Right.
So it's phenomenal for me to speak to hygienist audiences because they're driven, they're hungry for knowledge, they're motivated, they care about the patients. And as a presenter, you get that back, and it becomes very interactive and more impactful, the information does, than just a straight lecture.
And then that continues. You want to do it more, they want to learn more, it just becomes...
That's very true.
A cyclical.
That's exactly what happened.
Well, Dr. Nagelberg, it's been so wonderful to hear about your practice, but there's more that we want to discuss in the second segment. So will you be back to join us?
Absolutely. It's been
All right. Stick around. We are going to be talking about the systemic oral link, gingivitis, medical issues. Stay tuned. Really important stuff.